So we just want to look at generally how result interpretation for therapeutic drug monitoring be like. Okay, how result interpretation for therapeutic drug monitoring be like. Okay, so result interpretation for therapeutic drug monitoring. Therapeutic drug monitoring is you just trying to go around, okay, I'm giving a drug to a patient, so I'll now be monitoring the levels of this drug in the patient's blood. Do you understand? And all of that. So it's both an art and science. It requires a solid grasp of pharmacokinetics, clinical context, and timing. So the time at which you actually initiated the test to is very important for you to get in better results. So factors that usually affect the result interpretation is timing of the sample collection. So at what time did you actually do the test? Okay. So dosage regimen. Okay. So consider the dose. How frequently did the person actually take the drug? Through what route did the drug actually get into the system of this person? Okay. Then formulation. Okay. How is the drug being made? And what next? Therapeutic range. Okay, so for the drug you are trying to monitor, know the range at which this drug is considered safe, so that if you measure it and you see that it is outside the range, you can just know that you actually have a very bad market. So patient specific factors. So you consider things like the age of the patient, the weight of the patient, renal functions, pregnancy, are they pregnant, comorbidities. Okay, so clinical status: is the patient responding to treatment? Are there signs of toxicity or therapeutic failure? Like, as you are looking at the patient, are there any discomfort? Okay, and what are they? So drug interactions, this one you're trying to consider, okay, what drugs was this other drug given together with, okay, that might have possibly collaborated to cause more issues to this patient. So this is just an example scenario, which please you can pause to look at it, right? Pause to look at this example scenario on gentamicin.